very unique experience that we got to have here. Our state actually is a certificate of need state, which means that our government decides how many of a certain program is allowed within the state in a certain area. So because of that, we were unfortunately not able to have a bone marrow transplant program because there was enough hospitals around us that already had a bone marrow transplant program. So instead, we decided when CAR T came out to really try and go for those, because it was kind of unfortunate that we were having to send a lot of our CAR Ts or our BMTs off to other sites. And we really wanted to keep them because they had established relationships with us and our staff. So we went to the state and made sure that it was okay that we did a CAR T program, and especially a CAR T only program. And then from there, we started to leverage a lot of the different departments that we knew that we would need in order to start this program. So everything from clinical teams, EC, ICUs, contracting, legal, and all of those. And luckily, we had a lot of administrative buy-in that was able to help us with a lot of the resources and getting started. And when we even got a consulting team that was able to help us to really understand a lot of the contracts, FDA requirements, some of the FACT requirements as well. And so that's where we started out, just dividing those different departments into about 6 different subcommittees. And we actually use the FACT standards to kind of outline where we go and what we need to do in order to launch the program. I think one of the biggest challenges that we still unfortunately struggle with as a standalone CAR T program is because we don't have bone marrow transplant to begin with, we are not a FACT accredited site. And though we've aligned everything that we're doing with FACT, and we do plan to go for FACT in the future, because of that, a lot of insurance companies unfortunately have refused to work with us. So even still, we've had to refer out some of our patients to other centers around us that are FACT accredited. So that's just our goal, to get a FACT accreditation. Beyond that, a lot of the contracting was very complicated. And kind of what we did for some of that is really using what CAR T is to get people motivated to really want to work on this program. So we started out giving education on what CAR T is to a lot of the different departments, some of the departments that aren't used to some of these things. So even IT, legal, and all of them, and just letting them know what CAR T is and what a big difference this is going to be giving to our patients, so that they really know this is something that's going to help people, and this is why I want to really help. I would say the biggest thing is reach out to centers that are doing it. Reach out. In the very beginning, we were very fortunate. We got to go to the ASTCT conference before we even launched our program, and just started networking with a lot of the different sites that are doing CAR T across the country, letting them know we are kind of a unique thing where we're not a BMT program. And people are really interested, and allowed us to see some of their policies, see some of their educational materials that we could adapt it to our own. So I think reaching out to a lot of centers across the country, you'd be surprised. Even your direct competitors, they're honestly really open to helping you to be successful. And I think that really helped us as well. So one of the things that we've been doing, and we were very lucky to be able to do, is really working with the drug companies, because we do hope that this will be a more common thing for there to be standalone CAR T programs, because honestly, we're showing that it's possible. We've had a lot of success stories with CAR T. We've had very safe infusions. Our patients have done very well. So we want to work with the drug manufacturers to make sure that other centers that are maybe smaller, don't have BMT programs, can do CAR T and be successful. So like one of the things is we got to work with one of the drug companies to make sure that they allowed non-FACT centers. So we were the first non-FACT center to get one of the different manufacturers. And so now working with them so that they can understand what are the barriers for these CAR T, these small centers, these small institutions, and making sure that they're able to support those different centers as they try to onboard their drugs as well. So we're hoping to also advance this so that more centers can be a standalone CAR T program. I think we're doing very well. I mean, we're very fortunate too that we are a small program, but we belong to a big hospital, and of course we acknowledge that that has of course helped us, but we're hoping to still show that small centers, small community hospitals could still do this as well. And we're hoping to start a mentorship program so that we can help other programs in the future that may need help starting these programs.